Pharynx. So I have already once covered this topic. As per your request, I am once again taking revision of the pharynx. So good morning to everyone. And it was planned at 9:15 due to the some network problem. We have postponed it, and just now I am starting this one. So all of you know this is one question pharynx comes and under the 10 marks LAQS. So you should able to write all the three parts of the pharynx and diagrams. So when you see this diagram, definition of the pharynx we are going to deal. So pharynx is a wide muscular tube situated behind the nose, oral cavity and larynx. So clinically it is a part of the upper respiratory passage where the infections are common, so that the upper part of the pharynx, this is, you are going to see upper part of the pharynx, it transmits the air because, as I have told in the definition and introduction, the pharynx is in a wide muscular tube and it is situated behind the nose, oral cavity and larynx. So clinically, it is a part of the upper respiratory passage where we go at the inlet of the trachea. We include trachea, bronchus, lungs, includes as a lower respiratory passage till the alveoli. So when you see the diagram of this pharynx, as behind the nose, behind the oral cavity and behind the larynx, all you are going to get in this as a pharynx. So this upper part of the pharynx transmit the only air, and the middle part of the pharynx transmit the both air and food, but one at a time. And lower part, which is transmit the, that is the one which is we are going to get the, that is only for the food. So lower end of this will continue as a esophagus. So lower end of the laryngopharynx continues as a, that is the, we are going to have the esophagus. So first of all, you have to understand what is the definition of the pharynx. Pharynx is a wide muscular tube. This is a wide muscular tube, dotted region, and situated behind the nose, oral cavity and larynx. And clinically it is included as one of the upper respiratory passage. And this upper respiratory passage including, and infections are more common in the upper respiratory passage, so that upper part which is behind the nose, that upper part only transmit the air ever food enters into the nose, and lower part transmit the food only, but middle part it transmit at food and air but one at a time. Means what? When we swallow the food after deglutition and during the deglutition, when we swallow the food, that time, that fraction of moment, the respiration stops. So that indicates that that passage becomes one way for the food. And when we breathe, then that is for the respiratory passage. So oropharynx is both, you have to remember. Then going to the dimensions of the pharynx. Totally dimensions of the dimension will be the total about 12 centimeter in length, one which is extending, and the width of the almost all upper part of the pharynx. This is, we are going to have the that is the one which we are going to have the widest. It is, and it is a 3.5 centimeter, and it is a non-collapsible. It never collapses or stops the respiration or the respiratory passage. Middle part is a narrow and lower part is a narrowest. So lower part is the narrowest part of the gastrointestinal tract. Sorry. So what is the meaning of this? The upper part of the pharynx is widest, middle part is narrow, and lower part is the narrowest. This is all about the dimensions and width of the upper part is 3.5 centimeter, and total length will be the of the pharynx is 12 centimeter, and upper part of the width is 3.5 centimeters. Then what are the boundaries of the pharynx? So it is very important. I have shown you this is all we have studied now, just 12 centimeter upper definition and air food and all you have come across. Then comes about you have uh, can you hear me properly? Is it okay?
Yes, sir.
Okay. Can you see the diagram?
Yes, sir.
Okay. So whatever the boundaries of the pharynx you have to remember. When you see this is the area of the pharynx, this is the diagram I have told for the 10 to 15 topic. This is one diagram I have told you. That is when nasal wall, lateral wall of the nose, when it is asked for the auditory tube, tubal tonsil, hard palate, soft palate, tongue, mandible, tonsil, and larynx, cartilages of larynx, trachea, esophagus, and pharynx. So for all this one diagram you have to remember. Here, first of all, boundaries of the pharynx. This is superior boundary, and inferiorly it will be continuing the esophagus. This is anterior boundary and posterior. So first of all, you have to remember superiorly, the superior boundary of the total pharynx is bounded by the base of the skull. This is what you have to see, base of the skull, including the posterior part of this is the body of the sphenoid bone, and we have the basic occiput. This is a basic occiput. Means what? We have the base of the skull, body of the sphenoid bone, and basic occiput are the boundaries for the superior boundary for the pharynx. Then inferiorly, the pharynx is continues as a esophagus at the sixth cervical vertebrae. So you are going to get six cervical vertebrae. Below this, the sixth cervical vertebrae, the pharynx will be continuous as that is the esophagus. So posteriorly, it is bounded. Almost all this posteriorly, it glides over that is the prevertebral fascia and separated from the cervical spine. These are the cervical spine you have, and this is all pharynx is a muscular tube which is glides over the prevertebral fascia, which separates it from the cervical spine. We have the cervical spine like C1, we have atlas axis, and we have the third, fourth, fifth, sixth cervical vertebrae. So those you have to remember. Then anterior wall of the pharynx, this anterior wall is not making the complete one. It is having the communication with the cavities. So it communicates with the nasal cavity, that is nasopharynx communicating with the nasal cavity, oropharynx communicating with the oropharynx, that is oral cavity, and laryngopharynx communicating with the larynx. So anterior wall of the pharynx is incomplete. You have to tell anterior wall of the pharynx is incomplete because it is cavities communication. There is no specific boundary or structure which is seen on anterior like superior, inferior, and posterior. So that anterior boundaries for the pharynx, you have to remember it is incomplete because it's communicating with the cavities. So what I have told, superior boundary, base of the skull, body of sphenoid bone, basic occiput. Inferiorly, it continues as that is the esophagus at the lower border of cricoid cartilage. You have to remember. Then posteriorly, the pharynx glides over the prevertebral fascia and separating it from the cervical vertebrae. Anteriorly, it communicates with the nasopharynx, oropharynx, and laryngopharynx. anterior boundaries or anterior wall of the pharynx is incomplete. That is you have to remember. So on each side, as you know, the on each side it is attached to the pharynx is attached to the medial pterygoid plate, pterygomandibular raphe. You have to remember just this one. Then you have to tell about the it is attached to the mandible, tongue, hyoid bone, thyroid, and cricoid cartilage. So it is a you have to remember attached to the mandible, tongue, this is a hyoid bone, and thyroid and cricoid cartilage. So you have to remember about the this is all about the total attachments of the that is the pharynx. On each side, both the side, it is pharynx attached to the mandible, tongue, hyoid bone. Then I have told the that is a cricoid cartilage and thyroid cartilage, thyroid and cricoid cartilage. Then this pharynx is communicating on each side with the mid-layer cavity through the auditory tube. This auditory tube that is communicating with the middle ear cavity. That is you have to remember specifically nasopharynx communicating with the middle that is the middle ear cavity. Then this pharynx is related to the on each side we get the styloid process, and all the on each side we have the carotid sheath structure like a common carotid, internal carotid, external carotid, and we have the internal jugular vein, vagus nerve. All they are the pharynx related on each side. So this is all about the boundaries and attachment relations of the pharynx. So what I have told, what are the structure? Boundaries, superior, inferior, posterior and anterior. Then I have told the on each side what are the pharynx attached. And communication I have told. Then I have told the pharynx is related to the on either side by the styloid process, muscle attached to it, common carotid, internal carotid, external carotid, and we have the that is a vagus nerve. So this is all about the boundaries of the pharynx. This you have to understand first. Then we are having the next part that is the parts of the pharynx. For the descriptive purpose, the pharynx is it is totally pharynx is divided into three parts. We have the first one, which is you are going to get. The pharynx is divided into three parts, into whatever the total nasopharynx, oropharynx, and laryngopharynx. As you have seen in this diagram, behind the nose, the part which is behind the nose is called as a nasopharynx. Part which is behind the oral cavity, oropharynx. Part which is behind the larynx is laryngopharynx. So you have to remember about the all these things. You have to must know what is the nasopharynx, oropharynx, and laryngo. Sometimes 2 marks questions they have asked name the parts of the pharynx. Just you have to name nasopharynx, oropharynx, and laryngopharynx. Now we are going to call this how you have divided the pharynx. For the cavity of the pharynx is divided into three parts. That is nasal part of the pharynx is nasopharynx, oral part of the pharynx oropharynx, laryngeal part of the pharynx is laryngopharynx. That you have to remember. One by one we are going to deal nasopharynx, oropharynx, and laryngopharynx. So my dear students, first we are going to deal about the nasopharynx. So when you see the nasopharynx, this is all the part which is extending up to the here, and that is we are going to call as a nasopharynx. So here the nasopharynx is the upper part of the pharynx situated behind the nose and above the lower part of the soft palate. This is all is the soft palate and this is the hard palate. This is lower border of the soft palate. You have to remember this lower border of the soft palate to the we have the upper part of the pharynx situated behind the nose, and till that it is the lower border of the soft palate. This is all included as a nasopharynx. So this nasopharynx is resembles like a nose. Structurally and functionally, it resembles like a. Now I am talking detail about the first part of the pharynx, that is a nasopharynx. So in this nasopharynx, the first one that I am explaining here is the nasopharynx is resembles like a nose structurally as well as functionally. Means what? Number one, it is respiratory in function. No food ever enters in this region. I have told upper part of the pharynx transmit the air only. No ever food enters into the nasopharynx. So it is a respiratory in function like a nose. Then the wall of the nasopharynx are, that is a non-collapsible. They never collapse and blocks. That is a, they are made up of the all the structures which are non-collapsible like a nose. Third one, like a nose, it is lined by the ciliated columnar epithelium. So this is almost all lined by the ciliated columnar epithelium. Fourth one, mucous membrane is supplied by the trigeminal nerve. So you have to remember, my dear students, the nasopharynx is structurally, functionally, it is like that of the nose. Why it is like that of the nose, nasopharynx? Because it is a respiratory in function, no food ever enters it. It is non-collapsible, lined by ciliated columnar epithelium, supplied by the trigeminal nerve. Next comes about the anteriorly, this nasopharynx. This anteriorly, it communicates with the nasal cavity through the posterior nasal aperture. Means what? Here we have the anterior nasal aperture, opening orifices, and here we have the posterior nasal aperture. So now I am dealing with a little bit about the boundaries and other structure points of the nasopharynx. So nasopharynx, first you have to tell, upper part of the pharynx situated behind the nose, called as a nasopharynx. Then structurally, functionally, like it is a nose. Why it is nose? I have told the 4 points. Next you have to remember about the anteriorly, communication and boundary. This anteriorly, the nasopharynx is communicates to the nasal cavity through the posterior nasal aperture. Then inferiorly, it communicates with the, that is a pharyngeal isthmus. This pharyngeal isthmus, lower border of the soft palate to the posterior wall of the pharynx. That is we call as a nasopharyngeal isthmus. That you have to remember. Soft palate to the posterior wall of the pharynx. Then laterally, we have the lateral wall of the pharynx. We have the opening of auditory tube here. We are going to have the auditory tubal opening here in the nasopharynx. And we are going to get the auditory tube at the level of the inferior nasal concha. This is the inferior nasal concha at the level we are going to get. And it is 1.2 centimeters behind it. And the tubal elevation, where it is opening, we have the tubal elevation. This is a part which is we call as a tubal elevation. And we have the fold of salpingopharyngeal fold, which is one which is you are going to get it here in the this, that fold of mucous membrane that you are going to get. Then roof, whatever the roof you are going to get, and posterior wall, continuous slope opposite the basic-occiput sphenoid bone, and we have the, that is the anterior arch of the atlas. That is all forms the roof of a roof for the, that is a nasopharynx. My dear student, very important. You have to remember about the first is nasopharynx, upper part of the pharynx, which is situated behind the nose, called as a nasopharynx, widest part, and it is structurally resembles like a nose, structurally as well as functionally, that you have to remember. Next, I have told anterior communication, inferiorly communication, boundaries like you have to explain, communicate posterior aperture of the nose, inferiorly we have the pharyngeal isthmus that you have to know. This is bounded by the lower border of the soft palate to the posterior wall. Then lateral wall, which presents the following pharyngeal opening of the auditory tube at the level of inferior nasal concha to 1.2 centimeter behind it, and tubal elevation. Where it opens, there is elevated part, tubal elevation. Then salpingopharyngeal fold there only. Then we have the roof and posterior wall. This roof and posterior wall for the nasopharynx is continuous slope opposite the, that is a, we are going to have the opposite to the, that is a basi-occiput and body of sphenoid bone, and we have the anterior, that is a anterior arch of the atlas. These all will be forming the total roof and posterior wall for the nasopharynx. This mucous membrane, anterior wall of the arch of atlas, this in front of this, there is a basi-occiput, there is a collection of the lymphoid tissue called as a pharyngeal tonsil. In front of the basi-occiput here, in the mucous membrane, there is a collection of the, that is a lymphoid tissue, and that lymphoid tissue collection we call as a nasopharyngeal tonsil. And these nasopharyngeal tonsil develop in children and smaller absent in the adult. Means they are very well developed and seen in the children. As age advances, adult age crosses, then they become smaller or disappears. But these nasopharyngeal tonsils we are going to call as a nasopharyngeal tonsil, aggregation of the lymphoid tissue opposite the basi-occiput, that we call as a nasopharyngeal tonsil. These nasopharyngeal tonsils, pathologically enlarged and tonsils, is called as an adenoids. It is present may make the nasal breathing impossible. Because of this, these children may breathe from the oral cavity or the mouth. Mouth breathing starts. If there is a adenoid or the nasopharyngeal tonsils are enlarged, infected due to the common cold or common coryza and all, influenza, that time they are infected, enlarged. So such time child may breathe through the mouth because these adenoids, pathologically enlarged pharyngeal tonsils, are called as adenoids. So this is, you have to remember about the in the nasopharynx. There is another collection of lymphoid tissue present at the nasopharynx behind the tubal opening. This is a tubal opening, auditory tube. Behind this, there is one more collection we are going to call as a tubal tonsil. So we have the two aggregation of lymphoid tissue. One is we are going to have the opposite, the basi-occiput. Basi-occiput, there is a collection, and behind the tubal opening, there is a collection, tubal tonsil. And opposite the basi-occiput, that we are going to call as a nasopharyngeal tonsil. And if they are enlarged, we call as an adenoids. So this is all about the first one, nasopharynx. Very important to understand what is nasopharynx part. Then I have told structurally it is functionally like that of the nose. Why it is so? I have told non-collapsible trigeminal nerve supply, and which is transmits the air, ciliated columnar epithelium. Then I have told the boundary communication, anterior communication. Inferiorly, it is a pharyngeal isthmus, we call lower border of the soft palate to the posterior wall. That is very important. And tubal opening, nasopharynx communicates with the mid-layer cavity with the auditory tube or tubal opening. That is, you have to tell. So this is all about the nasopharynx. So next we are going to the next part, that is the oral part of the pharynx, oropharynx. So when you see, this is a part which is, you are seeing almost all this part up to here, epiglottis, and here this part we are going to call as almost all the oropharynx. So this is the middle part of the pharynx and situated behind the oral cavity. Behind the oral cavity and middle part of the pharynx is called as the oropharynx. Above it communicates with the nasopharynx. See diagram here. Above it is communicating with the same, you have to apply here. How we are, it is the nasopharynx below communicating with the oropharynx with the pharyngeal isthmus. So like that you have to use the word Above it communicates with the, that is you have to remember. Then we have the above communication with the nasal nasopharynx through the pharyngeal isthmus. So that you have to remember. Next part,
सर डायग्राम दिसेना झाली.
1 minute. Can you see? Can you see?
हा सर आता दिसतंय.
Okay.
हा सर आता दिसतंय.
Oropharynx I am talking. Middle part of the pharynx is called as a oropharynx, and it is situated behind the oral cavity. Next, you have to remember about the communications. Above it communicates with the nasopharynx. So that is a nasopharynx through the pharyngeal isthmus. This is, I have told how it is lower border of the soft palate to the posterior wall of the pharynx. That you have to. In front, it communicates with the oral cavity through the, we are going to oropharyngeal isthmus. Oropharyngeal isthmus, we are going to bound it lower border of the here soft palate to the upper border of the epiglottis. So you have to remember oropharyngeal isthmus. Here I am showing you the nasopharyngeal isthmus. Here I am showing you the oropharyngeal isthmus anteriorly boundary. Below the it communicating with the larynx. So level of the it is the laryngopharynx at the level of the upper border of the epiglottis. This epiglottis, upper border of this level, the almost all will be the oropharynx. Behind it is supported by the body of the axis and axis vertebrae and upper part of the body of the third cervical vertebrae. Second and third, that level we are having the posteriorly, they are supported. So what anteriorly it communicates the oral cavity through the, we are going to have the, that is a oropharyngeal isthmus. Superiorly, that is a pharyngeal isthmus. Then inferiorly at the level of the epiglottis, upper border, it is communicating with the laryngopharynx. Posteriorly, it is supported by the second and third cervical vertebrae. Lateral wall of the pharynx, which is represents the palatine tonsil, and this is we call as a palatine tonsil. We are going to get it, so that you have to remember about the palatine tonsil. I will keep behind this palatine tonsil little bit word. You have to explain in the oropharynx, that is a palatine tonsil. So this is all about the middle part behind the oral cavity, that is the oropharynx. Next, we are going to third part, laryngopharynx. This is a part which is you are going to see. This is all is the laryngopharynx. So here laryngopharynx, this is the lower part of the pharynx situated behind the larynx, and it extends from the upper border of the epiglottis. This is the upper border of the epiglottis to the lower border of the cricoid cartilage. This is the cricoid cartilage. Lower border of the cricoid cartilage to the upper border of the epiglottis. This is area is called as a laryngopharynx. So what are the anterior wall of the laryngopharynx is formed? Anterior wall of the laryngopharynx is formed by the inlet of the larynx. This is the inlet of the larynx, and posterior surface of the cricoid and arytenoid cartilage. This is the arytenoid and cricoid. This posterior surface of the cricoid and arytenoid and inlet of the larynx. They are the anterior wall for the laryngopharynx. Posterior wall is that is you are going to get the, that is the fourth and fifth cervical vertebrae. Posteriorly below, that is sometime you have the third in the part or the sixth. Third and sixth cervical vertebrae also make the in the that is in the totally making the posterior wall for the laryngopharynx. But main you have to tell the posterior wall of the pharynx, laryngopharynx, is that is formed by the fourth and fifth cervical vertebrae, and partly by the, that is you are going to get the lower part of the third and sixth cervical vertebrae. Third and sixth lower part. Fourth and we are going to get the fifth cervical vertebrae. You are going to get, that is almost all they are making. See, upper border of the sixth cervical vertebrae and lower border of the third cervical vertebrae and fourth and fifth cervical vertebrae. They are making the posterior wall for the, that is the laryngopharynx. This is a level which is third and fourth. You are going to get fourth and fifth maximum. The level will be the fourth cervical and fifth cervical. Sometime lower part of the third and upper part of the sixth cervical vertebrae. So anterior wall I have told, posterior, that is the posterior surface of the cricoid and arytenoid cartilage, that you have to, inlet of the larynx you have to remember. Then I have told the posterior wall, fourth and fifth cervical vertebrae. On each side, when you see the larynx on each side, you are going to have there is a depression called as a periform fossa. When you see the on each side opening on the throat region at the level of epiglottis, on this level, there is a depression on each side, and that each side depression we call as a periform fossa. P-I-R-I-F-O-R-M, periform fossa, that you have to remember. So this is all about the primary and introduction. That is, I have told the definition, introduction, dimension, and parts of the pharynx. Then more detail about the contents and all about the nasopharynx, oropharynx, and laryngopharynx. This much is most important you have to understand. And few points relating the palatine tonsil you have to remember. This is a tonsil which is orally making opening the oral cavity. You can see on each side that is a tonsil situated below the that is a soft palate, that we are going to call as a palatine tonsil. So my dear students, this is a commonly throat pain, swallowing, during swallowing there is a throat pain appears, that is all due to the tonsillitis. So that is, you have to remember those commonly we have the palatine tonsil. In children, I have told tonsil aggregation. Those are the adenoids or the nasopharyngeal tonsil. So nasopharyngeal tonsil, tubal tonsil, and now I am talking about the palatine tonsil, that you have to remember. Here palatine tonsil, I have told, it is situated below the soft palate. Then it is bounded by the palatoglossal arch anteriorly, palatopharyngeal arch posteriorly, and tonsillar fossa, almond in shape or oval in shape, having upper pole, lower pole, and it has the anterior border, posterior border, medial lateral, two surfaces. Two surface, two poles, and two border, and arches two held, palatopharyngeal and palatoglossal arches. Within this is situated, we are going to call as a palatine tonsil. This is you have to explain in the oropharynx. Tonsillar artery supplying the blood supply, tonsillar vein draining the venous drainage. As it is a lymphatic aggregation, so that is no specific lymphatic drainage, as it is a lymphatic organ like, that is a tonsil. One is a lymphatic aggregation. Then we have the applied anatomy like a tonsillitis, inflammation of the tonsil, palatine tonsil, we call as a tonsillitis. If they are enlarged and commonly making the fever and other complaint and repeated occurrence of the tonsillitis and child or the person becoming sick, that time we go for the advice for the tonsillectomy. Tonsillectomy. Surgically removal of the tonsil is called in a tonsillectomy. So this is all you have to write in the, this is all in the oropharynx, that is a palatine tonsil. I have covered here a little bit about the palatine tonsil. So 1 minute is remains, time is going to all over. So I have covered these three parts. Next lecture on Wednesday, I will cover the muscles of the pharynx and clinical anatomy. This is all about the pharynx, and you have to know all these diagrams. So this is all about the today's lecture. Read, make it notes, 10 marks you have to write properly. So understand the points all these with this diagram. So I hope that my dear students understood that is the pharynx first part. Then second part I am dealing in the next lecture, that is the muscles of the pharynx. So here we